Heart disease, we've found out, is the leading cause of death in the U.S. for both men and women. And the scary thing is, usually no signs or symptoms of heart disease, which is why it's so important to get screenings and pay attention to your risk factors. So we have Dr. Abram Cottrell with us this morning. You're a cardiologist, and these are the issues you deal with every day.
Absolutely, and our focus is actually to try to keep people healthy. We offer a lot of high-tech care, but it's better if patients don't have to come in for that.
Of course, and with National Heart Month, we've been following these 6 women that have done the Go Red Better You Challenge, and we've been telling their stories and everything that they've done, and we thought to wrap it all up, we'd love to get some tips from you and talk about how people can really recognize their own risk factors as they're watching.
Sure. So, the risk factors are pretty well known. They come from the Framingham Heart Study, which was done a long time ago. So the main ones are cigarette smoking. That's not good for you. Diabetes, high blood pressure, high blood cholesterol. There are things that you can't modify, such as age and family history, but the things that we can modify are pretty important. Exercise is one of the most potent things you can do to improve your heart health. So if you're exercising 30 minutes a day, 5 days a week, that can reduce your risk of heart disease events by about 40%.
Wow.
Recently, we also found out that the Mediterranean diet is very healthy. In fact, it can be more potent an intervention than statins, which we recommend all the time to prevent heart disease in patients.
Wow. So some good research, some diet, exercise, kind of getting more specific, though, with things that we've known. And I know you brought some of these props with you because you've been talking about one of the heart centers you have. We're talking about this guy right here. And I know some of the women that we saw in their segments telling their stories, and one of the things you mentioned, they talked about a family history of heart disease. You know, just how important is that to know, did my grandmother go through this? Did my father?
Yeah, so there are certain things that stand out as red flags. So if anybody's had a heart attack before the age of 50, that can be a marker of risk. It turns out that there are certain conditions that are silent, so even if you've had testing, it doesn't show up. But, red flags in family history are things like people passing out or dying of unexplained causes. Those can be signs of a genetic problem that can lead to heart attacks or sudden cardiac death.
Sure, and I know, a lot of us don't get to see the look at, that you see of all this, but what exactly happens in the heart when you have high blood pressure or you have that high cholesterol?
Right, so the blood vessels are on the outside of the heart. So the aorta is this red blood vessel up here. On here you can see the different branches of the coronary arteries. So if you have high blood pressure, high cholesterol, cigarette smoking, diabetes, plaques tend to build up in these arteries, and if they get occluded, you can get heart attacks.
You know what? I think we are just about to go to break, but these are wonderful tips. Diet, exercise, we appreciate you being here, and we will have more of the morning show right after this.